Kruger with Queen City News.
Hello, thanks for taking some time to chat with us, everybody. Dr. Myers, I wanted to ask you, today we're hearing from the Mecklenburg County Health Director, who says it seems that Mecklenburg County has reached its peak with Omicron. I guess this question will be in two parts. Do you believe that we have reached our peak, and therefore is this help from the federal government certainly necessary, but is it, could you have used it months ago?
We are happy at any point in time during this pandemic to receive help. We have a team that has worked tirelessly for now going into our third year of the pandemic. So there hasn't been a moment when help in any shape or form hasn't been welcome. I think certainly with this most recent surge, we've seen the highest capacity that we've faced, but we've also seen the impact on our teammates and across the healthcare industry affecting teams as well. So there would be no point in time where help in any shape or form to support our team and ultimately the care we deliver to the community we serve, that wouldn't be brought in with open arms.
Thank you. Caroline Hudson with the Business Journal.
Hi, this question is for Mark. I was wondering if you could clarify the amount of time that your team will actually be helping at Pineville and if there are any opportunities for extension.
So the Department of Health and Human Services and the National Disaster Medical System typically has a 14-day rotation for each team. So myself and my team will be here for that 14 days. At that time, Pineville, the governor, Department of Health can ask for an extension of either my team or have a backfill of other teams or ask for future assistance as needed.
All right. Brandon Hamilton with WBTV.
Yes, good evening. This is for Dr. Myers. Are you able to elaborate more, I guess, on specifics of what you all are seeing, especially here in Pineville, in the ER department? What are the wait times? Are they normal 3 hours, 2 hours? Kind of what are you all seeing?
We're challenged throughout ERs across our system as well as across the region. And so there's a lot of fluctuation. One thing that we do see, though, is we certainly have increased volume of patients coming to our emergency room. As I had mentioned previously, we are impacted by the scope of the community that we serve, both in North and South Carolina. And so we do see an influx of patients from those areas, and that can significantly impact the volume of patients arriving at our emergency room. And this last surge has been no stranger to that. Certainly since the very beginning of the year through where we are at present, we've experienced high volumes across our ED as well as across our system.
All right. Shamaria Morrison with WCNC.
Hi, I have a question about what resources will be freed up now that this team has come in, and how is the hospital system going to work when it's, when those resources are no longer, freed up once the team leaves?
Mark, do you want to take the first part, and I'm happy to take the second?
Yeah, I can take the first part. So generally, when HHS and the National Disaster Medical System deploy teams, we're meant to augment the staffing that is in place. So we're here simply to help bridge the gap during this current surge and provide care for those patients for a short, brief period of time as we kind of move into the future.
And as we reach the end of this deployment and the team leaves Pineville, we'll continue to pull on all of the resources that we have so far. We're fortunate to be part of a large health system that has looked for opportunities over the past 2+ years to be able to restore our teammates, to redeploy within our system. We have a robust runner system where we redeploy non-clinical teammates to help with some of the non-clinical tasks across the hospitals, to help alleviate some of the needs with getting supplies for our clinical teams right there at the bedside. And so we'll continue to pull all levers that we have throughout the course of this pandemic to keep the team going and serve the community.
All right, we go back to Drew again, and if anyone else has additional questions, please signal that into the chat box.
Thank you, and I apologize if I missed this, but is Atrium Pineville still carrying out elective procedures? And if so, is that the best use of resources at this time?
We've looked very carefully over each surge at balancing the number of elective procedures with the increasing volume of acute care needs. What I can tell you is over the last 2 years, procedures that may have been elective 2 years ago, as time has gone by and they've either been deferred or delayed, they no longer are elective. So we work even on a day-by-day basis to ensure that patients that need care emergently and essentially do get it.
Back to Caroline Hudson with the Business Journal.
Dan, this might be a question for you, but I was wondering if other Atrium Health facilities are looking into having extra staffing help through the COVID surge.
In terms of federal support or in terms of just needing staff?
Specifically the federal support, yes.
Yeah, so the application was made through the state to FEMA, and this is the result of that application. Brandon Hamilton?
Yes, sir. This is for Matt. And just real quick, Matt, just to break down, I know a release kind of broke down the positions, but it had like 11 and 5 oversight. I know you just said you have 12 personnel and 4 oversight. Is that correct?
Yes.
Okay. Are you able to break down as far as the 12, like for their positions?
I don't want to misquote, but we have physicians, advanced practice providers, mainly nurse practitioners for this particular mission, nurses, paramedics, a logistician, safety officers, and administrative support.
Okay, thank you.
And Drew?
Thank you. Last one for me. So what, if anything, is Atrium Health doing to recruit and keep any nurses or other staff members that they have? Because I got to believe that the hospital system is, not immune to what other industries and businesses are experiencing, which is a labor shortage. I mean, clearly, if we're bringing in federal help, it's needed. So what is being done from Atrium Health to try and keep our people here serving our community?
So a lot of things, some of which I referenced earlier, but really investing in our teammates and helping us to use our entire family of teammates to get us through this. Looking for opportunities for those in potentially more elective areas or non-clinical roles to be able to give of their time to help support the environment that our clinical care teams work in. We've certainly brought in additional traveling, in particular traveling nurses, to help support some of the need here as well. But not just at Pineville. There is no area in healthcare that's been untouched by the impact on our workforce, both because of the duration of the pandemic, but certainly the degree of surge with this Omicron pandemic.
And Drew, to be clear, we are hiring. Mark, if you could, I think it would be interesting for folks to hear, what is life like doing this sort of thing? I mean, you're seeing multiple locations, multiple hospitals. What is life on the road doing this sort of thing like?
Well, first of all, to make it clear, we're all considered special government employees. So we're what that basically means is we're PRN for the federal government. We all have full-time healthcare jobs. Our clinical staff are all full-time clinical staff back in the Denver metropolitan area. And we're working in systems very similar to what we have here in Pineville. We are on this team, and as we get called up, we travel wherever we need to travel to lend a hand. And, healthcare across the nation, across the globe even, it's a team sport and it's a family. And, no matter where we go, we create friendships that, go on and on over the years from the people that we, deploy with and assist. So, life on the road, as you ask, it's kind of sad when we need to go out because there's been some kind of public health emergency, some kind of disaster where humans have been affected and friends and neighbors have been affected. But what we find is the bonds that we create, no matter where we go, really last a long time. So it's very rewarding. It's hard to leave home, but it's very rewarding work.
And how many days a year typically would your team spend on the road?
Our teams are on call currently 3 months out of the year. And during those deployment months, in the last 2.5 years, you pretty much go out every time you're on call. Pre-COVID, you'd go out, for the big hurricanes, earthquakes, things like that. And a global pandemic was not really on our mind prior to about March 2020. So.
And you may or may not be able to speak to this, but what goes into the selection of a location like Atrium Health Pineville to receive this type of support?
Goes through the governor's office. So from the state to the federal government, those requests then get kind of resource allocation, whether it's FEMA, whether it's the Department of Health and Human Services like I work for. They kind of find the appropriate resource for the need and deploy assets as appropriate.
And describe for us the shifts that you guys do. You guys work quite hard when you do these.
It's all mission driven, but our typical deployment schedule is, 12 on, 12 off for the 14 days.
All right, last call for any other questions. All right, seeing none, we certainly appreciate A, you joining us tonight, but B, especially you being here to help us out at Atrium Health. It's on behalf of all of us, we extend our deep gratitude and appreciation for lending us a hand and helping our teammates there at Atrium Health Pineville Emergency Department. I know it's going to be something that's very well received, and we hope you enjoy your stay and make some of those great lifetime friendships. Thank you to our media. Again, the recording will be available. Please follow up with Kate if there's something that you missed on that, and she can send you a link to be downloaded. And we appreciate you joining us this evening. Thank you so much.